Hello, everyone. Good morning, good afternoon, wherever you are watching us from. Once again, we are here, and this month is Pink Month, which is Breast Cancer Awareness Month. But at VZ Customs Ghana, we want to talk about the breast and the care that can be given to the breast, both male and female. And we are saying that breast is so important, both for the male and the female. This year, the theme for Breast Cancer Awareness Month is no one should face breast cancer alone. No one should face breast cancer alone. And we have our hashtags and we have our slogans too. For this year, our hashtag is Think of Pink. Think hashtag breast cap. And then our slogan is care cap breast. Care cap breast. So when you meet a friend, you can say care cap, and she can say breast. Care cap breast. Care cap breast. So that should be our slogan for the whole of October, whilst we celebrate and adore breast for this Pink October. Now we are going to talk about a little bit about statistics. Then we go on to talk about how to care for the breast in general, either a male or a female, because breast cancer is also affecting males. So if you're a man, don't think you are free. You can definitely also get cancer of the breast. So let's talk a little bit about statistics. And for our statistics, WHO is saying that globally, around the world, breast cancer normally affects Blacks. So Caucasians, like those of us who are Latinos, who are Africans, are the ones that breast cancer actually affect us a lot. And it's around 2 to 3 million new cases every year, 2.3. So for instance, in the whole year, in the whole world, new cases that we get every year is 2.3, which is 2.3% of the population in the whole world. And this represents in both sexes, either you are male or a female. Then also, WHO also did a research in a form of awareness, and they realized that those who have less access to health care and health facilities are those ones who suffers a lot. So they are raising awareness this year because they've given themselves a target, a goal that they want to reach up to 2040, that every person in this world, you should know your status, you should have easy access to health care, you should have the proximity of a health facility to your where you stay should be closer, so that anytime you are not feeling comfortable in your breast, you can easily go and have examination done, because the key message is early detection saves life. And also, there are three main major key things that they are working with. One, the first one is early detection. So if you realize that even though there's something around your breast, like a pimple or like a sore, or you feel pain or it's painless, you can easily go and visit the facility for them to do the examination for you. Then also, all the stakeholders that came together, they said that one, It is so important to detect it early. Then also timely diagnosis, then comprehensive treatment. So these are the three core values that they are basing on for every individual in this world. Then also they came up with objectives. The objectives are one, raising awareness and driving behavior change. That's what PZ Customs Ghana we are doing now. We are raising awareness and driving behavior change. So we are educating everybody watching us, telling them what you should look out for, what you should do to prevent breast cancer. So by educating the public, by giving the teachings, by counseling, by encouraging the public that they should visit the facility as soon as possible, you realize either you're a male or a female. Then also facility knowledge sharing and partnership. So PZ Customs Ghana is partnering with Midwife Ruby to bring the knowledge to the general public so that they will know that breast cancer, when detected early, you can save yourself and make your home happy as a woman or a man. Then you should also bear in mind that breast cancer, aside that, can even migrate all the way to your lungs, your kidney, to your brain cells, to your heart, to the whole body. So when the education is given and you learn, you can also share with somebody. Then also, the third objective is to support national adaptation of WHO Global Breast Cancer Initiative. That's what we are doing. Every October in Ghana, we celebrate Breast Cancer Awareness Month. We put on our pink t-shirts, our pink ribbons on our chest. We as health workers throughout the whole of October, at our workplaces, on television stations, everybody gets involved so that at the end of the day, that drum that we are beating, everybody will hear of that drum. Then also, the fourth one is promoting patient support and address disparity. One, when you are being diagnosed breast cancer, that doesn't mean that's the end of your life. No, either you're a man or a woman, no matter how the stage is, either stage one, two, three, or four, there's always hope for you as the patient. Either stage one or two, they can take the breast off. Stage three, four, they can treat you palliative. But at the end of the day, you still have a life to live. So for you to know that you're accepted, in some countries, in some communities, they have people who have gone through the surgery, they are fine, they are alive, they are part of that support groups. When you go to the facilities, you see them there, encouraging mothers who are newly diagnosed, counseling them. They are part of the health team for you to know that people are still surviving, people are still alive when it's being detected early, when treatment and management is given early, when the diagnosis is also given early, you have a long life to live. So that is the message WHO have for all of us, for us to know that when you are being diagnosed with breast cancer, that is not the end of the world. You can live and live and live. At the same time, also WHO is trying to bridge the gap between health facility and the indigenous living, making sure that every community or every district should have a facility base that even when you are even referred to that particular district hospital, when you are being diagnosed promptly, then comprehensive management and treatment can be given to you. So on our screen, we'll see we have the male breast. Now, the male breast has loops, then it has duct, and it has nipple. At the same time, also, the woman also have fat, has loops, has ducts, has nipple, and has areola. So when you look at it, the breast of the female is the same as the man. The only difference is the woman is built in such a way that the breast needs to enlarge while she's growing, while she becomes a teenager, to prepare her for motherhood. But for the man, it's not like that at all. Now, when we look at the female anatomy of the breast, you will see that there are a whole lot of ducts around our breast. So even when you raise your hand up, one hand up, and you start even palpating from the armpits all the way to the down, you see that the makeup of the woman's female breast is unique. It's different from the man. So even for a man to even develop breast cancer, you realize that it takes a beginning. If you are not so careful, you don't pay attention to your breast, you think it's nothing. Unlike the women, definitely we see so many changes, especially when we are going to menstruate. We see a change in our breast. When we even get pregnant, we see change in our breast. When we deliver and we are breastfeeding, we see changes in our breast. But the man doesn't go through that phase. So men normally don't pay attention so much to their breasts like women we do. So all the men watching us, we are telling you that pay attention to your breast every month at least. Pay attention to your breast, then you know that if something is wrong or not. The first one is the color around the breast do change. So your areola should match your skin color. So if you are fair, automatically your breast is fair. So either it becomes brownish, not black, brownish, or the brownish could be light brown, or not dark brown, but in between light and dark brown. You see that. But if you're a white person, you see that your areola, it becomes pink. So always the breast color matches the areola. If you're a dark person, automatically the areola becomes dark. So the skin color of your breast should match your areola. That's what we should always pay attention to. Then also around our armpits are lymph nodes, all the way to under our breast. So the lymph node should not be inflamed, like it shouldn't be big than unusual. So there's a difference between boil in your armpit and a lymph node. So the lymph node, there are no pus formation in lymph nodes, but balls, there are pus formation. People sometimes do think um, lymph nodes looks like ball. No, with ball, it's hard, it's painful and contains pus. Pus is that yellowish fluid in the ball. But lymph nodes, when it's inflamed or is swollen a little bit, there's no pus formation. You feel the lymph node that is swollen. It's hard and definitely is painful. But one thing about breast cancer nodules is those ones are painless. They are painless. If you don't know, we are telling you today, there is no way breast cancer, the pimple that will be around your breast is painful. No, it's painless. So you be tempted to squeeze, and that is when the problem will start. So we are saying that anything around your breast that you see which is unusual, please don't squeeze it. Then with the male also, when you see the picture on your screen, there is two different types. So the normal male breast has muscles and fat tissues. When you look at the fat tissues, it's not swollen, it's not inflamed. The next one, you will see that the fat tissues are more and the muscle is also more. There's a difference between this and the cancer of the male breast. This one, it can be corrected, it can be taken off because there's excessive fat tissues in the breast. That one surgery can be done, biopsy will be taken. Definitely, it's not cancerous. This is not cancerous. My cameraman, if you can show me the male breast which has cancer in it, so that our viewers can know the difference between this one and that one. So this one is not cancerous at all. You see that the fast tissues, yes, good. So this is the male breast. When you look at it very well on your screen, now you see the tumor in the breast. Have you seen the difference? So that is the difference of the previous one and this one. This one doesn't affect the whole fat tissue. If you look at it carefully, it's closer to where the loops are. Then also, it's closer to where you see your areola. It doesn't affect the whole breast like the first one. So men, please pay attention, because a lot of men come to the cancer unit whilst they are in their final stages of cancer of the breast. So it can be detected early when you pay attention to your breast. I'll come back, I'll answer questions, which a lot of questions are coming in, but I'll answer the questions. Let me do my education. Then we also know that there are signs of breast cancer in women and men. So first, I said there will be changes in skin texture. There will be nipple discharge. The discharge, if it's breast milk, is accepted. But when the discharge is bloody, greenish, yellowish, greenish, that should tell you there's something wrong with the breast. Then also there will be dimpling. You realize that the breast from the armpit all the way closer to the actual breast will be sagging down, and it will fall in like a dimple on your chin, a dimple on your cheek. You see the dimples that some of us we have around our cheek. You see the same dimpling or around the breast area. Then also the next one that you will notice is there's lymph node changes. So the lymph nodes become more swollen than usual. You can actually feel it. Then you see breast nipple pain. So there's a difference between breast sore if you're a nursing mother. There's a difference between sensitivity when you are having your preparing, whether you're ovulating or you're about to have your menses. And there's a difference between nipple pain in breast cancer. When you look at your screen very well, you see that there'll be reddish. It's so red, it looks like a sore, which definitely it will be bleeding also. Then we'll see retracted or inverted nipple. You don't have retracted or inverted nipple by nature. Your nipple is erected. Then all of a sudden you realize that your nipple is getting retracted, it's going in, or it's turning upside down. That should tell you that there's something wrong with the breast. Then also changes in skin color around your armpit area all the way to where the breast is. Then also there will be swelling, unusual swelling of the breast. Then changes in breast size. So the size of the breast becomes bigger than the normal. So we'll look at types of breasts. As women, we have different shapes and sizes of breast as women. I hope my cameraman can show us that one too. Then when you look at it, you see where you fall under. We have the types of breast. No, not this one, the pink one, please. This one is the breast sizes. Yes, thank you. So these are types of breast that every woman definitely will have. Automatically, one breast is always bigger than the other, but not unusual at all. Not unusual. So when you look at the breast, We have three types of breast. You look at it, you stand in the mirror, you look at yourself, and you know where you fall. I know where I fall. You should also know where you fall. So these are the categories, but in all, it's six. Especially when you look at when you count from the row 1, 2, 3 down one, normally you see that type of breast in teenagers. The last row on your, for me, it's my left, but when you are watching, it's going to be your right. Especially when you start developing breast. This is how your breast looks like. Gradually, you graduate and you graduate all the way to the upper parts. When you have breastfed 3, 4, 5 children as a woman. Yes, this is how we are expecting. So it's so beautiful from the first one, second one, third, fourth, fifth. Then the sixth one, when you breastfeed more than 3 children, you should expect that you have a breast like this. Now, women are created special. Women are unique. You should be comfortable in yourself. You should be comfortable in your breast. Definitely, we'll talk about sagging breast. We'll get there. How to prevent it. Then also, we are saying that what is the ideal breast size for a man or a woman? So, averagely, about 53.6% of men have average breast size. That is the flat one that we see, not the one that they'll go and lift the weight and the breast, you get that 6 pack. No. Average, the flat one, the normal Ghanaian or African man flat breast without 6 pack, which is flat, we have about 53.6%. Then those who are obese or slightly obese, that is the large, they are about 35.3%. Then the small ones, those who are slim, very slim, especially also those who are entering puberty, teenaging, those people, the teenagers, the men, those ones are 11.0%. Now, when we come to the women, average breast size, those who category, you could see this one is an average breast, this one is an average breast, this one, it fits the breast size. When I finish, I'll show you the bra size for both men and women. So the average woman, when we put all together, is 60.4%. For those who have large, beyond measure, who puts on 2 or 3 bras to support their brazier, that when they even go to market, they can't find their bra. They need to add and add and add. They are 30.5%. Then those who can go on braless for the rest of their life, even when they deliver, the breast is still the same, it's still standing. Nothing has changed. They can go without bra till they die. Those people are 9.1%. So when you compare men and women, you will see that women are the major people in all the percentages. We are leading. So that should tell you that you are special as a woman and you are unique as a woman. And cameraman, please, can you show me the breast sizes so that we talk about, so the brazier, the ideal breast size for men and women. So now for the breast size for men and women. So we have AAA. So if you don't know your breast size, today we are doing that at PZ Customs. An A cup So the A cup is the larger band. So those ones are the ones who have the triple A's, those who have the big breast. But at the end of the day, they are not that plumpy. But the cap is an A. Then we also have a C cap. That one is 3 inches large for the band. Then we have the DD or the E cap. Those ones are 5 inches large for the band. Then we have the G cap. That one is 7 inches large. Then we also have the I or L cap. That one is between 9 to 12 inches. I know somebody who is in that. Then also we have the B cap. So that the B cap automatically is 2 inches. So from the AAA or the A cap, those ones and the B cap are mostly adolescents, but they have the breast. The breast is developed, it has developed, but they are small. So both A and B can go for teenagers. Now C and D can go for after teenage, which will be after 20 years or maybe after 19 years. Then the D or E cap or triple D or the F cap can be for those who are either breastfeeding or has given birth to one or two. But strangely, you'll be shocked. You see a teenager around 16, 17, 18 years who is putting on a DD cap currently as at now because of the genetic makeup. Naturally, she is busty because I've seen one before. Then we have the G cap, the H cap, the I, the L, then the M to Z. So especially, I want to concentrate on the M to Z. So the M to Z cap are those ones who the breast is so big beyond your imagination. You can see some of them on social media. And those people, it's so hard to come by their bra size. But the bottom line is you need to put on the bra. If you don't put on the bra, your breast will sag more. The breast will become more bigger than usual. Because what the bra does for you as a woman is to hold it, make sure it grows in a particular way. It wouldn't fall off. It wouldn't fall off at all. Then also for the breast size cap for men and women, there is an ideal breast size for men and women. If I can see that picture also, my cameraman. So it's a bra. The blue side is for the male and the pink side is for the women. So thank you very much. So this gives us the percentages of cap size for men and women. So a man can put on a D cap. Don't be shocked. Yes, 41% of men can wear a D cap of bra. 31% of men can wear C cap. 12% of men can wear a B cap. But when you go to the female side, you see 22% can wear a B cap, 25% can wear a D cap, and 41% can wear a C cap. So if you're a man, there are men who have breasts, especially those who are obese, those who have the weight. Most of them also go in to take a lot of fat tissues through surgery so that they can have that flat chest. But those who leave it, some put on bra. Don't be shocked when you are walking on the way and you see a man putting on bra. It's no news because they have their bra sizes here. They have. Nowadays, even when you watch soccer a lot, you see the men protect their chest. It's a black, like a tube that they wear to protect their chest. because of the thoracic cavity. So please, don't be shocked of what I'm telling you. Some men put on bra, and that is the percentage you are seeing on the screen. Now, every woman, you need to care for your breast. Either you're a breastfeeding mother or you are a nursing mother, or you are not breastfeeding at all, you need to care for the breast. When you are taking your bath, now, Mr. Cameraman, my viewers can even see my face now. Let them see my pink t-shirt. You can go back and let them see my face now. Thank you very much. When you take your bath, after taking your bath, your care of your breast is just washing your breast area with just water. You don't need soap. You don't need to take a hard sponge to be scrubbing and scrubbing your breast. But under the breast, definitely you can get a mild, gentle Casson's baby soap. Apply it on your soft sponge, then you can wash under your breast. Not on the areola, and not on the nipple, and not on the tip of the breast is not accepted. The areola, those black bumps that we see. And cameraman, I want to see, my viewers want to see my face. Thank you. My viewers want to see my face. Thank you. Yes. So on the breast, you see the areola, those bumps that we see around the areola, they secrete oil to moisturize that area for us. And also to care for the breast after taking your bath and cleaning up. You can apply our baby oil or our baby petroleum jelly, just a little. Use it to apply around the areola, then the nipple. Massage gently before you put on your bra. That's how to care for the areola, the nipple, and the tip of the breast. Both for men and women, we can do just that. Then also, paying attention to our breast as women when we have finished having our menses and want to do our self-breast examination. Our self-breast examination is so easy for you to do. So easy. I'll demonstrate, then I'll put it on the screen, a picture on the screen, then you see it yourself. First, you put your hands together like this because your breast needs to align together. Then you just bend down. You see that they will definitely symmetrical, so they will align. Immediately they align, then you come up gently. Then you can just rub your hands like this on the breast. You rub. Then you go in circular form, paying attention to where you feel pain or you wouldn't feel pain. Then also, you hold at where the areola is. Then you just massage gently. Then you squeeze the nipple to see if there will be any discharge coming out of it. Then you press the breast also to see if you feel severe pain or you feel any swelling or you feel any movable thing in your breast. Then we have the one that we raise our hand and put it at the back of our hair, and we'll do our self-examination, paying attention from the armpit all the way to the breast that we do. If you can't do it, you have a nearby facility, just walk in. Any midwife at the facility, say hello to her. Tell her, please, I want you to have my breast examined for me because we are in pink October and you have all the right, even not only in Pink October, but every month you can walk boldly to a facility that they should do the examination for you. Then also from 25 to 40 years, you can have a breast scan done. Another school of thought will tell you 25 to 35, you can have a breast scan done. But there are exceptional cases. Exceptional cases are those ones who feel they are below even 35, they are below even 25, but the feeling that they are having in their breast is not normal. So those ones, they can have a mammogram done. But after 40 years, you can have a mammogram done. And that mammogram can be done every 2 years. But there are some who have a family history. The grandmother died of breast cancer. The mother died of breast cancer. The aunties died of breast cancer. The great great grandmother died of breast cancer. Those ones, every year, you can have, if you're above 40, you can have a mammogram done, because our key message is early detection saves life. Then somebody will say, what can I do to stay away and have a healthy breast? 1, diet. 2, exercise. 3, let's avoid smoking, minimize alcohol, or stay away from alcohol at all. Then also self-examination every month and going for your yearly breast scan and mammogram done. Then also questions that people ask, I will definitely answer those questions after today. Somebody is asking, how can I prevent sagging of my breast? So sagging of your breast, 1, it can be prevented by putting on bra. The bra that you put on, it should have broad straps and it should hold the whole breast. There are some bra when you put on, you see the breast is falling off. Those are not good bras, which means those bras are small for your breast. The bra should cover 2/3 of your breast, all the way to your back. The strap shouldn't be small. So in quotes, you should get a bra which has a broad straps like Anita. Yes, they sell it in the market. And the back straps should also be like an Anita, but it shouldn't be up, it should be down, so that when you close it, it wouldn't come up for people to see the bra at the top and your dress somewhere. No. So this is the clue of what you can look out for when you are choosing your bra. But the nice thing to do is, if you don't have a measuring tape, every woman should have a measuring tape. When you are ovulating, you can measure from your back to your front. When you finish menstruating, you should also measure. It gives you a fair idea when you get pregnant to purchase your bra. Because when you get pregnant, automatically your breast size, it changes. It's not that you go to the market and you be trying, or you buy so many bra that doesn't fit the breast. No. You should know your breast size. Like I said, every woman needs a measuring tape in her house. So whilst ovulating, you measure. When you finish your menses, you also measure. That gives you the breast cup that you should use, especially when you are pregnant, when baby comes out and you are nursing. Then periodically, 1 or 2 occasions, definitely, you can let off the breast, especially when you are going to sleep. You have to let off the bra and feel free, because we don't want compression while sleeping. So we want to breathe easy. So it's not advisable when you are sleeping and you are putting on bra. No, it's not advisable at all because it puts pressure on your chest. It changes your breathing pattern. There are some bras which are so tight that when you put it on, even during the day and you are walking, you've tightened the bra so much because um well, I was told it's called they want to pump the breast up. It's totally wrong. You can't, when you do that, you put pressure on your chest region. The brazier, when you put it on, you should be able to breathe. You should be able to feel comfortable. You should be able to move yourself freely with no problem. But at the same time, also, it needs to hold the breast firm. It shouldn't be falling off. So that when you even kneel or you even bow down, still the breast wouldn't be going down. No, the bra has already hold the breast. So it will be still firm. So women, let's pay attention to that one too. Then also with men, what you can also do is at least having press ups every morning, 30 minutes, and will make the breast firm enough. Excess fat tissues wouldn't develop because of the diet. With women also, we can also do the normal this way. You don't even need to even go to the gym. Every morning you can do this 30 minutes. It prevents sagging of the breast. Every morning, just put your hands together like this. Every morning. Every morning, just put your for 30 minutes, it prevents sagging of the breast. Yes. In case you don't know, you should know. I'm teaching you definitely. It prevents sagging of the breast. Then also, our diet, especially high fiber diet. High fiber diet, I recommend for every woman. Then minimize red meat. Then, like I said, alcohol, if you've not drank before, is good. Stay away from it. If you've not smoked before, it's good. Stay away from it. But those who are already drinking, those who are already smoking, we are saying that just minimize it. And if you're a breastfeeding mother, be proud of yourself because research has shown that mothers who breastfeed their children from day 1 till 2 years have a lower risk of getting breast cancer. Yes. When you finish the exclusive, you continue as a supplement for the baby all the way to 2 years. You have a lower risk. Then those who also don't do breast enhancement, those who don't abuse estrogen pills, emergency contraceptive is an emergency. It's not a daily morning pill. You only use it when there's an emergency. So, like I'm saying, it's an emergency pill. How can you take an emergency pill in a whole year? That's something you've been taking every month. You are just abusing the pills. And possibility that you can get cancer is high. So to the young ladies watching, it's an emergency pill. Just visit your family planning provider or health worker or doctor, and they'll help you to have an informed choice so that you can choose a method that suits your body system. Then you can fall on that and have it done, but not an emergency pill you are taking every month. No, it's an emergency pill. That is the name of it, emergency pill. And when you abuse it, possibility of you getting breast cancer is high. Then there are so many oils in the market for enhancing the breast that they are firming the breast, they are making the breast big, they are making the breast elongated. All those oils are not healthy for the breast. The only oil I can recommend, which is proven and proven by doctors, is a baby oil. And that one, even a little quantity is enough to massage the breast, especially the areola, the nipple, and the tip of the breast. Because those black or pink or brown bumps around the areola produces oil on its own to moisturize that place for us. Then also, questions which have been asked. Let me go to my questions. Let me go to my questions and answer it one after the other. Today I have lots of questions that beat my mind, but my viewers want me to answer the questions, which I'm going to do just that. I'm going to do just that. Okay, so my first question, definitely, okay, so that my cameraman has shown a self breast examination on our screen. He has shown the self breast examination on our screen. So let me take one after the other. Let's discuss it and let's talk about it. So the first picture, you see, you put the arms, you drift it together like the way I did it. Then you raise your arms. Then you examine your nipples. Then you rub it up and down like I did. Then in a circular form. Then you squeeze. So you wedge the breast. So you press it to your chest. This is another way of doing self breast examination. Aside the one that we put our hands at our back and check the left and the right, you can also do this. This too is laudable. So anyone that you are comfortable in, please choose it and do it. After the program, you can definitely go back to our page and watch the program again and look at the pictures and try it back home. You can even save the video and share it with friends so that they can also learn from you. Let's share so that our friends can also benefit from us. So let me go to my questions. I want to go to my questions because today I have lots of questions to answer. Yes. How do you know if your breast is healthy? Yes. So your breast, the skin, it shouldn't be flat or smooth. That is the truth. Immediately the skin around the breast is flat. Like when you put your hand around it, it goes smoothly. No, it shouldn't be. When you look at a breast itself, when you touch the skin, it's slightly rough. It's slightly rough. That tells you have a healthy breast. Then also, there are some that have birthmarks. There are some even have stretch marks, especially when you are pregnant and you deliver. Some people get their stretch marks on their breast. It's normal. But the whole actual truth is the skin around the breast shouldn't be smooth. When it's smooth and it's thin, it's not good. Then also, my next question is how can I improve my breast quality? So this is for breast milk production. Okay. So we should breastfeed more often, eat more fruits, vegetables, and fluids more, and high fiber diets. Then protein because you are breastfeeding. Then lots of vitamin C because you need it because of the baby. Then also we should put on breast pad to hold on to the excessive milk that is coming. Then we should also express the breast milk intermittently. And we should breastfeed our babies, especially at night, because that's when more production of milk is done. We get more production of milk at night and midnight. So from 12 to 4 a.m. is the appropriate time to breastfeed and express the breast milk. Then also, there are lactation cookies. When you go to mother cares and certain shops also, there are cookies, there are lactation milk, which is also there, which will boost you, the mother, your immune system, to help you produce more milk. My question, how do I prevent breast sagging? Okay, so you manage a healthy diet and a healthy weight, because if your breast automatically matches your body, there are some genetically they are busty, you can't do anything about it, but they are slim and the breast is there. There are some also, they are plumpy but their breast is small. There are some who are slim, they also have small breasts. And there are some who are also plumpy, who have bigger breasts. So at the end of the day, you should manage a healthy weight. So for me, instance, I know myself. So I'm managing my weight so that my breast doesn't sag. Then also, I should have a comfortable bra. So I put on bra which makes me comfortable at the end of the day, holding my breast and making sure that my breast doesn't sag. So always the nipple stands. When your breast is sagging, you realize the nipple goes down. But when the breast is not sagging, the nipple, no matter how huge your breast is, no matter how small your breast is, the nipple always stands. Then you should always, you can have a hormonal test. In the advanced countries, even before the sagging starts, they do have hormonal tests for you to know that prolactin is depreciating in your body. So take these medications that to prevent the breast from sagging. Then also, we should consider, especially pregnancy. That's why family planning is there. Ideally, WHO says that after 2 years, you can get pregnant again. If everything is okay, money is in the house, the child or the children who are you've given birth to, they are well taken care of with no problem. Everything is fine. All is well. Ideally, 2 years you can have another child. But if you don't consider, and every year you are giving birth, 9 months, 8 months, you are pregnant again, possibility that you can have a saggy breast is high. So let's consider that one too. That's one family planning is there for us. Then having the surgery done. If you know your breast is too much for you to carry, there are some I see, the breast is so much, she can't even carry, she can't even get bra. Please go to the hospital. Now, there are doctors, there are good surgeons in Ghana who can do that for you, that they will reduce some of the fat tissues in the breast, reduce some of the muscles, take certain things out so that you can have an appropriate breast. At the same time, irrespective whether you have not given birth before, you can still breastfeed so that the breast wouldn't weigh you. It's not fashion. Some are using that as a fashion. Some are also asking for more implants so that they'll get more. But at the end of the day, if it is too much for you and you can't bear, please talk to a doctor who can refer you to a plastic surgeon, which they can have it done for you. Then also the workout, what I showed you on the screen. Let me put my phone down. That you put, if you can't pay for a gym and go to the gym every morning, just do this for 30 minutes. That is your workout every morning. Just do this for 30 minutes every morning. Just do it for 30 minutes, and that will prevent the sagging of the breast. Okay, so let me go to my next question. Okay, what are the benefits of holding a breast or your breast? Okay, so one, it helps in stimulation of the blood vessels in the breast. Two, it also sends nerve signals to the brains so that oxytocin will be released. Then another one also, if a lump is developing, If a lump is developing in the breast and your partner is even playing or fumbling with the breast, automatically he or she will notice and tell you, I feel a lump, I feel something hard somewhere, or I've seen something on top of your breast I think we have to pay attention to. So those are the benefits when your partner plays with your breast. As a woman, it stimulates definitely, and it brings that intimacy between the two of you. Then um my next question, so how do I take care of my nipples? So I said it earlier, all you have to do is to make sure that you wash it with water after bathing. You don't need soap, you don't need sponge on your nipple area, the areola area. You don't need it. All you need is just water. And then after the shower or the bath, you just apply Akasum's baby oil in the form of massage around that area, and you are good to go. Then, is it important to touch a woman's breasts? Yes. Okay, it is very, very important to touch a woman's breast. It provides a sense of comfort, one, for the woman. It relaxes her also, and it reduces stress, and it promotes feeling of well-being. Definitely, if you touch the woman's breast, definitely it provides comfort. You see, for the woman, it relaxes her, especially when the breast is so sensitive, when it's so tender to touch that, especially when she's ovulating. She really needs those massages on the breast and makes her feel okay and makes her feel comfortable. Then also, especially when you massage, it relieves her of those back pains at her back. It's very, very good for you to have that one. As a man, you can do that one for your woman and your partner, and your woman also can do that one for you. So, with my last question, does stirring of a woman's breast good for a man's health? Yes, it is. It is. First, it lowers the blood pressure of the man. Secondly, also, it raises the heart rate of him. So no matter how tensed your partner is, we are encouraging all women, especially when the man comes from work. It relaxes him. Allow him to gaze, not necessarily, but allow him to gaze. It relaxes him and makes him more comfortable and reduces his heart rate, no matter how stressed or annoyed he is. This should tell you, as a woman and as a man, that breast is so important. You know, last year theme for Breast Cancer Awareness Month was Suck a Breast. That was a theme. And this year we are saying that nobody should go through breast cancer alone. And our hashtag is Cap a Breast. So you see, breast is so important both for men and women, especially for the babies. Last month we did a breastfeeding month. We spoke about breast. This month we are talking about breast health. That should tell you how important the breast plays a vital role in our body. So take good care of your breast. Make sure that you do what we have discussed by doing regular exercising to prevent sagging of the breast. Allow your partner to do the examination of the breast, eating healthy diets, then having breast scan done from 25 years to 40 or 35, then also having a mammogram done after 40 years. At least twice in a year, you can have the breast scan, and twice in a year, you can have a mammogram done if all parameters are okay. We also learned that men do wear brassiere or bra. Yes, men wear bra. If you don't know, you are hearing from me. Men wear bra depending on the sizes, and we gave the percentages also. We also learned that WHO says that yearly, every year, 2.3 million of us, the whole world, new cases every year before the year's ends. Immediately we kick January, it's estimated new cases is 2.3 new cases every year. And it's our hope and I believe that by 2040, these 2.3 million new cases in the year can come as low as in its hundreds. And we are saying that you are bridging the gap. Bridging the gap means that there should be a nearby facility in every community that you can boldly walk and go and have your breast screened. And that you can be referred to a district hospital so that when it's been detected early and prompt referral, there will be all-inclusive management so that no matter where the stage of the cancer is, either the first stage, second, third, or fourth, you can have the best of the care that you need. We also learned that breast cancer affects Blacks and Latinos especially. So I am at risk and you are at risk. Either you are a man or you are a woman. We are all at risk. So let's come together to curb it. Early detection, save life. On behalf of PZ Customs Ghana, we say we love you for coming our way and learning with us and having this precious moment with us and going all out to share whatever that you've learned here, that breast cancer is real in men and women. It's not only in women, but also in men. We love you and we'll meet again next month. Bye.